Hello and welcome to NeuroDriven Performance, where we offer you solutions where other healthcare options have failed. My name is Dr. Nolan, and I'm here to talk to you about a question that I often get asked in practice, and it's a good question. And that question is, what is an intensive program? And it's a good question because since the very beginning of my time in practice, I've always worked in functional neurology. I did a diplomate in neurology when I was still in school, and I did multiple graduate degrees after that in neuroscience and clinical neurology. And so my patient base very early on consisted of complex neurological cases like traumatic brain injury and paralysis and spinal cord injuries, neurobehavioral disorders, as well as neck pain and low back pain and athletic injuries and a typical sort of chiropractic profile. And since a large part of my early practice, I operated within that typical chiropractic model, where you would come and see me anywhere from 1 to 3 times a week, depending on severity, and we would get results. But at a certain point, I started taking my patients that I would normally see for 45 minutes to an hour, particularly my complex neuro patients, and I began working with them 2, 3, 4 hours at a time, and I would just watch their results skyrocket past where their normal treatment trajectory would indicate that they would be at that time. I began taking my head injury and paralysis patients, and I started working with them for 3 and 4 hours over a sequence of days, and we would not only get them to start feeling their legs, but to start walking within the first few sessions, when their other practitioners had said that that was never going to happen. And it's because we didn't take our foot off the gas and we didn't sell these patients short on time. And that's when I really began to understand that this is the crux of neuroplasticity. There are 3 factors that determine how effective neuroplasticity is going to be. And those factors are frequency, intensity, and duration. So what does that mean? That means that we need frequent care, we need an appropriate amount of time to deliver that care, and we need adequate intensity in order to create sustainable change within the brain. And this intensive model that I've now geared my entire practice around is built on these fundamental principles of neuroplasticity. And honestly, I don't really enjoy working with patients for 45 minutes to an hour at a time, or whatever insurance is willing to cover, because most of my patients are coming to see me because they've been everywhere else already. And most of them are under such metabolic distress and inflammation that they're just not going to get the same results that they would if they were doing 2 to 4 hours of therapy a day. And this is true across the board. I work with a lot of high-powered professional athletes as well, and most of them, depending on the sport, practice up to 6 to 8 hours per day. And largely that's why they are where they're at in terms of their athletic career. So whether I'm working with people trying to increase their peak performance and output, or I'm working with neurodevelopmental delays and brain injuries, the principles of neuroplasticity still apply. This is particularly true for my developmental delays and brain injured patients. It's just they're so far behind that the only way to catch them back up developmentally is to invest more time. So it really becomes about how much time are you willing to invest in your child or your spouse? Because if you do, and you get out of that insurance model that really isn't equipped to handle these issues anyway, I promise you, you're going to get phenomenal results with us where other healthcare options have failed. If we fire networks enough, we're going to create efficiency within that network. So that patient, instead of coming in week after week after week for 6 months, a year, 2 years, we're going to see 1 to 2 weeks, maybe up to 6 weeks, depending on what's going on with the patient. And we're going to create those same changes much faster, and we're going to develop efficiencies much faster. And when I say efficiencies, what I mean is that you're going to retain the results, and you're not going to get better and then fall off, which is unfortunately what tends to happen in that typical model, where you come in and see me and get better, and then you get worse, and then you come in and see me and get better, and then you get worse. That's not my goal for you. We want to have you come in, and we want to create sustainable change so that you don't regress. And if you do regress, we'll know that there's a reason for it, and we can investigate possible triggers, from autoimmune issues to methylation, environmental toxins. There's a number of things, but we'll know what's going on, and then we can address it appropriately. The intensive model is just the fastest way to get results It's the best way to prevent regression, and it will eventually become the industry standard in neurological care. I think it's really important for people to understand that I did not create my intensive program to satisfy an insurance company. The purpose of my intensive program is to deliver individualized, tailored care. I'm not here in healthcare to bill for these certain codes so that I can get paid this amount based off of this duration of time, and I can't be thinking in that mindset if I'm going to get the person in front of me better. My responsibility is to the patient that I'm working with and making sure that they have the best possible results that they can get. I have to meet each patient where they're at, and I'm going to treat each patient the way I know they need to be treated. And that means if a certain therapy or treatment proves to be in their best interest, then that's the thing I'm going to do. I'm not going to let another organization dictate or manage my care for me. And having said that, thank you so much for your time today, and I look forward to seeing you all in the office. And until then, I wish you all many blessings.